Good evening and welcome to the second of two Inside Government shows produced by Cayuga Community College and shown on Spectrum, Verizon, Fios, ARMA, the Auburn Regional Media Access, as well as WIN 89.1, the college's radio station. I'm your host, Guy Cosentino. Our guests tonight are Cayuga County's Director of Environmental Health, a new Director of Environmental Health, Ani Fish, and the Director of Health, Education, and Public Information, Deborah Pickering, who has been here before, to discuss Cayuga County's efforts at lead poisoning prevention. 2 years ago, there was a lot of focus on this on the national level with some money from the infrastructure bill, President even mentioning it in his State of the Union. At the time, we talked about a Kiplinger article that said that lead still is a problem across the nation. It impacts the brain and nervous systems and may be linked to violent crime. And as I mentioned, in 2022, $15 billion was set aside to replace lead pipes in the nation, but that will only cover about 1/4 of the cost, at least back in 2022 numbers. So we've asked our guests on today to talk not only about lead, how do you look for it, how do you deal with it, but also what steps are being taken for remediation. First of all, congratulations on your new job.
Thank you.
We'll talk about that in just a moment.
Okay.
And welcome back to you as
Thank
well.
you.
And thank you for always coordinating some information about health. So for those who may not know, and I know we'll pop up some pictures in a few minutes, how big an issue is lead?
It definitely is a huge issue in our community, in the state, across the country. You hit on a lot of the key components. The major issue that we see is lead-based paint, which was banned by the federal government in 1978. We know that in our community, there's an aging housing stock, and it consists of a lot of lead-based paint.
So interestingly on that number, you had a great set of charts, and I don't think we'll necessarily pop up this particular graphic, but you basically said in 1978, 3 out of 4 of our homes right now were built before 1978. So
Correct.
There's a high probability they have lead. But lead is a two-part problem. It's not only paint, but it's also pipes, and we'll get to pipes at the end of the show. Am I correct on that?
Correct. You know, one thing that we'll talk about, I'll leave the pipes for probably a little bit later because we have a childhood lead poisoning prevention program, and the vast majority of those children are being exposed and poisoned by the lead paint and the dust associated with it.
And this is not necessarily just a rural or city problem. It is both, correct?
Correct, yeah.
Okay.
In the county, 75% of the homes are pre-1978. In the city, we actually have the 1980 as the marker for the year, but it's over 90%.
So I remember as a kid, which is a long time ago, that lead was the discussion. Why is it still a discussion, I will say almost 40 plus years later?
I would say because lead-based paint was actually a very sought-after building material, let's call it, and it was used for not very long, but it was a very high-quality paint at the time, and you don't really see very many people doing home renovations and stripping down paint to the natural wood. A lot of times they're just painting over and painting over. So anytime a child's toy, moving furniture, dings or disturbs the paint, each layer will chip off. And so it over time will reveal the paint that was painted on 40, 50 years ago. And then it just creates the lead dust, the chips, anything that can become a poisoning item.
And so in all this, do you have a given idea of how many cases that you have in Cayuga County in a given year of lead poisoning?
Yeah, in typical range, we are between 60 and 70 active cases that have an elevated blood lead level. As of January 31st, we had 66.
And so what are the effects of lead poisoning?
You hit on some of them. We know that exposure damages the brain, the nervous system, kidneys. It can get into the bones. And you know, I actually have a great little graphic here from Loyola University, and it's a ripple effect, as they describe it. You know, it's long term, and that's really a huge issue because young children are being exposed. They're developing, they have these health impacts. they get delays, hyperactivity, learning disabilities. Then throughout their teenager, stages of life, it might impact them during school and then throughout adulthood as well, retaining a job. We know, as you mentioned, criminal violence, reproductive health. It just is that ripple throughout the entire life cycle.
So on that particular front, but it starts originally with the brain and nervous system, am I correct on that?
Typically, there's so many variables when you look at lead. The length of exposure, the age of the child, the type of lead source. Nutrition plays a huge piece in lead poisoning.
I'm sorry, how so?
So,
Wanna talk about that?
yeah, so children, they grow a lot faster than adults. We're done growing, but children, they grow a lot faster. They absorb nutrients differently than adults do. And so any tiny, minuscule little piece of lead or
dust
lead
in the
dust,
house, in the kitchen.
dust in the house, you breathe it in, children crawling around, them putting their hands in their mouths, hands not getting washed. They get that lead in them, and it absorbs very quickly into their system.
So in doing this, of those 60 plus cases that you have, how did they come to your attention? Are they because a doctor's reported? Did a hospital report it? Did a parent just walk in the door? And I know we're going to pop up a graphic where you can get more information and you can make a call if you think your house is exposed. And you shouldn't look at it as a liability that you're going to have to pay for. This is to help somebody in your household, correct?
Correct, yeah.
This is a positive, not a negative.
Yeah, and I'm glad you mentioned that because at the health department we have 2 programs, and you mentioned earlier.
We joked because I looked at I didn't look at it as an acronym, but go ahead.
It's a mouthful. So we have what's called the Childhood Lead Poisoning Prevention Program.
Okay.
And we commonly...
Which is nicknamed?
CLIP.
Okay.
And we also have CLIP Plus.
Okay.
So those are grant-funded programs through New York State.
So let's talk about CLIP 1 first, or
So
a CLIP
just
without the...
CLIP.
Okay.
Let's just talk about CLIP first. That is when we have a child with an elevated blood level. We, every day, go in and check.
These are case management services. Okay.
Correct, yep. So at the age of 1 and 2, children are required to be tested. In addition, at every well child visit, they should be assessed for lead risks. And if they screen positive, they should be tested. So we get those reports, and if they are at an elevated level, then our team begins interventions.
Okay, so let me just pick on my local doctor, Dr. Graney. He sees, I do not have a newborn, but he sees a 1-year-old or a newborn. What tests is Dr. Graney and his staff doing?
Typically, it's just a little finger prick. Depending on the level, they may do a venous draw.
Okay, and so is the finger prick done as a normal part of a well visit?
Yeah.
So they're always testing. So is at that, again, I'm picking on Dr. Graney, who I think the world of. Is he referring that person to the county, or is he waiting for the parent to make the contact?
It goes into a statewide system.
Okay.
So we have access to that.
So
and then we communicate with the physician.
So of the 60 that you have, most of those are coming how? How are they coming to your attention?
Through the statewide system,
Okay.
and then we care coordinate with the physician's office. Some may have been in our system for years, some may be new. It's all over the spectrum.
I do want to pop up, and we have 3 photos that we're going to pop up on the screen. I know it's not germane just to this particular case management piece, but the first one is what I'll call the green door. It's, I don't know why oxygen is being used at this particular site, but these are photos that you also sent to us, which we appreciate. This would be normal chipping that you would see on the front door of a house, which should be a clear indicator right off the bat.
Yeah, so you can see in the middle of the door, the brown original wood is showing, and then also along where the door meets the casing. Every single time that door shuts, there's friction, and it can chip off and peel off a little bit more paint. And so those are that's one of the things that we look at when we're doing a lead risk hazard assessment. And then,
so I want to go to the second one, because that one's the more interesting to me,
Yes.
because that, I think, is in every household that has
Yes.
anybody under the age of 3.
correct.
Between, a bike they're riding around in the house, which they most likely should not be, or they've got toys and they're running whatever toy or blocks are going on. This is a door jam in a house.
Yep.
You can obviously see that's about the height of a 3-year-old. So I'm thinking, so what's the worry there?
You can actually see at least 3 different layers of paint in this one photo. So the worry here is you can see that there's chips and flakes all over the place and that they're accumulating on the floor. Every time someone walks over a chip, it breaks down, turns into dust, or just accumulates as dust over time.
And on door jams, I noticed, because I've been paying attention now that I knew we were going to do this, bathrooms and bathtubs, doors that connect with bathtubs.
Yep.
A lot of a problem, correct?
I'm not bathtubs.
Well, not necessarily the bathtub, but a door.
Oh, yes, because it
there's
swells
swells back and
for
forth.
moisture.
Yeah.
Yeah, so really any friction surface, any location where a door shuts or a window opens and shuts. I think we
So
may
the
have a
third
window
one is
photo.
a window, which I don't know that I've ever not seen, except on a new house,
Yes.
where you don't see this, especially inside the windows, if people can see it.
Yeah.
There's all this cracking
Yes.
and buckling there.
Yes, and I've lived in houses that have older houses from the early 1900s that have just the wood frames still, and they've been painted so many times over the years. And with the expansion and contraction due to temperature changes from the season, the paint just can't hold up over time, and it starts to chip and peel.
So are children the most at risk when it comes to lead?
Yes.
Yeah.
And we talked about this is through a blood test. Are there times that a parent will just reach out to the health department and say, hey, I think there's a problem? Or is that,
Yep. So that's Clip Plus.
okay.
Yep.
So what's Clip Plus?
So Clip Plus is more of the proactive program that we have, and it's somewhat new to the health department. We received the grant in 2021, but I heard you talking to Jeff prior to this, and we know our friend COVID was around then, right? So it really didn't get launched until, I would say, last year was our most effective year. And with this program, it's typically if you have a child 0 to 6 that's in the home on a regular basis. So even if you're a grandparent, you can call us. We will come in and do a free lead risk assessment. Or if you're pregnant even, say you buy a new home and you're like, I'm not sure what's going on here. I know it's from 1960. We're going to have our environmental health team come in and evaluate the situation. And do you want to talk a little bit about what they do?
Sure, yeah. So we currently have 2 public health sanitarians that are trained via an EPA course for lead risk assessors, as lead risk assessors. And they go into the home and they do a pretty informal interview with the family to see what their habits are, what their cleaning habits are, what their children do on a daily basis around the home, and then they will take a machine called an XRF. It's I should have looked at the acronym before coming. It's this little machine that shoots a laser, and it will tell you how much lead is in a component. So let's say we're looking at the door jamb, for example. They'll shoot the door jamb, and it'll tell you if any component not top layer necessarily, but any component, any layer of paint within that door jamb is lead positive.
Okay, so let's say a house is now identified as being lead positive. All up to now, everything is free. Am I correct? The testing, whether it's the blood test, whether it's getting case management services from Clip 1, whether it's having somebody go in and look at the property with Clip 2, Clip Plus, sorry.
Yep.
What happens then? So a house is identified.
Right.
You come to my house and I'm identified as got a lead problem. What happens then?
I think it really depends on the situation. So most houses that we're going into with Clip Plus, there is lead. So we have to remember that these are pretty extreme cases. So when we're looking at these, we have to then kind of take a step back. We can have lead in a home, but it can be a lead safe home, right? So at some point, someone could have come in and renovated it in a proper manner and be lead safe.
Okay.
So our team could come in and be like, yeah, there's lead in here, but it's at a safe level, and there's no dust, there's no chipping.
So of this, I want to go back to the 60-plus cases. So you have a child who has really elevated numbers. You want that child out of there, out of that house, correct?
Yes, depending on what their blood lead level is, we will try to relocate a child, especially if we go in and do the initial inspection and there are very severe lead hazards present. So you go into a house with something like this, and we will try to relocate the child. We have worked with other organizations to have a small amount of like housing stock available that is deemed lead safe. But it really, like Deb said, it really depends on the situation.
So what about the fear that a parent says, oh, if I tell them I have lead, I'm going to have to go live somewhere else. There's costs of renovating. How do you deal with those costs? I know in the past there's been grant money that's been out there. Is there still grant money to cover the cost of those 60 children? I'm sure some are in the same household, but you're really talking about dozens of different households, correct?
Yeah.
Yeah.
I think it's about calling and talking to our team. You know, don't be scared to call us. You know, you have to look at it in the perspective of we don't want the long-term effects of lead poisoning. We want to come in and just make sure that it is a lead-safe house. Some of the efforts are pretty minor in terms of renovations. You wanna talk-
A lot of times painting will do the trick. Encapsulation, we call it. So that would be slapping a coat
But
of
there are occasions where a family has to
Yeah.
leave the home.
Oh, yes,
Yeah,
of
there
course,
there are, and there are community organizations that we can refer them to as well.
And do you have any idea of this is mostly a really unfair math question, the percentage of, we have a roughly 50 in the city, I think a 52 to 55% rental to home ownership.
Yeah.
Are there higher numbers with rental properties versus home ownership, with those who have owned their homes?
In terms of our elevated,
Yes.
I didn't bring that number with me, but I do think there is a little bit of a higher percentage. I do know
Because that
that
brings in a new factor. That's a landlord
Yes.
who now needs
Yeah.
to
Yeah.
remediate.
I know we have a higher percentage of multi-unit homes that are pre-1980 in the
And can you
city.
mandate that a home, a landlord fix the problem?
Yes, we actually mandate that anyone who has a child with an elevated blood lead level, regardless of if it's homeowner occupied or a rental unit, that they address the issues.
So just because the child leaves the rental unit does not let the landlord off the hook?
Correct, yes, yeah. It can, the whole entire house can be vacated, or rental unit can be vacated, and it is not allowed to be rented out again until all of the items are addressed.
So-
And that's really clip, excuse me.
Yeah,
So I just
that's
wanna
the
remember,
reactive portion.
Because it does get a little confusing.
And I know,
Yes.
and
Yeah.
again,
Thank
there's
you.
numbers here that people can look at websites and look at numbers. I do want to go back to what the county's role is in some of these others. You have the Women and Children,
Yep.
Infants and Children's
Yep.
Program. Do they test as well?
They do routinely test. We work closely with them because obviously they're part of the health department, so they're great supporters. Nutritious eating,
Right.
you know, it goes hand in hand.
I want to go back to a doctor again. If a parent doesn't feel their doctor is testing,
They
For-
should ask.
they should ask.
They should ask, they
Yes.
should make sure, be their
But they
advocate.
could come to the county and get tested. Am I
Yes.
correct on that?
Yeah, they can
Okay.
call. We do testing at the health department for underinsured or no, if you don't have no insurance.
Okay. And what's the danger to adults? One thing that I notice, only because I think I pay attention to this, because I think my hearing is going. Hearing is a new pop-up that was not on my list 2 years ago. So I'm assuming that's a more of an adult issue. Maybe it's both, but it comes to mind with adults. What's the hearing angle here?
Well, if you're poisoned as a child, that could be a long-term effect. We do
Okay.
know that. Adults, we typically see it if you are working in a field where you're exposed to lead. You've really got to be in depth with it for some reason. So we don't see it as much by any means, but you could definitely be poisoned and be sick. We don't see it as often, though, I would say.
Before going any further, I did mention at the top of the show, you're new to your positions.
Yeah.
Congratulations
Thank you.
again. So how long have you been the Director of Environmental Health?
I took over in August when my predecessor retired.
So that was Eileen O'Connor. She has retired from the county. What is your portfolio? What are you responsible for?
Yeah, so as Director of Environmental Health, I oversee all of the programs related to, oh gosh, this is a very long list. So I'll just do it based on my individuals that I work with.
We're going to get lots of shows out of this. Okay.
Restaurant inspections, mobile home park inspections, campground inspections, children's camps, lead poisoning prevention. Our biggest two programs are probably our public water supply program and our septic program. And then there's a handful of other programs sprinkled in.
I guess we constantly have here is Dr. Adam Epfler,
Yep.
Who's looking at the watershed and looking at water quality. You work
Yep.
hand in hand with his office as well.
Yes. Yep, I work with Adam very regularly.
Okay, so other items that come under your purview, you mentioned restaurant inspections. How often are they done by the county? Those are my favorite section in the Citizen.
It depends.
Because then I'm trying to figure out when was the last time I ate there.
Yes. It depends how frequently those are done based on their risk classification. Low, medium, and high risk depends on what types of food they're preparing and how frequently they go through what we call the danger zone, which is temperature changes, heating and cooling.
And if I looked at the last 6 months, I would say fast food restaurants tend to have a higher unsatisfactory. Is that the correct term?
Yeah, we can. Yeah,
I have a
that's
different
fine.
term
That's
for
fair.
it, but
That's fair.
I don't think it's
we call
appropriate
them
for television.
we call them critical hazards.
Critical
Yeah.
hazards. They seem to be popping up more and more. Is that
Yes.
the case, and do you know why?
I would have to say the reasoning behind that is probably due to staff turnover and frequent staff turnover and lack of training.
Okay, all right. I just wanted to toss that out at some
Sure.
later
Sure.
day. I know that one of the items that also comes into play is how do you pay for all this? So is it county taxpayers? Is there state and federal money that's coming to Cayuga? I mentioned that $15 billion, but believe it or not, $15 billion across the United States goes fairly quickly. And I think, as I said at the beginning of the show, on lead pipes alone, that only covers 1/4 of the national problem. So where's the money coming from to fight lead locally? And again, going back to when I was a kid, it was an issue then, and it's an issue today. So it's not apparently being remediated at this pace that everyone would like.
Yeah. It's a mixture of sources. So our funding is from the New York State Department of Health. It does look like there may be funding coming down from the federal government as well. Local community organizations have funding available. I'm not sure if that's federal government funding or I don't know.
I do think it trickles down from the federal to the state government.
But that's grant-based that somebody has to apply for.
Yes.
Yeah.
Okay.
And they have a lot of restrictions too. So it's something they could reach out to us if anyone has any questions, and we can refer them to those organizations.
Do you know how, go ahead. I'm sorry.
We also do provide some assistance in certain cases. We provide cleaning supplies to all the CLIP Plus families, so those preventative families that are interested in getting.
So while you're on that,
Yeah.
there are some simple steps that you want to share
Yes.
that, or you can comment on each of these. But you said lead poisoning is 100% preventable.
It is.
But you must stay vigilant and be proactive. Shocking. Wash
Yeah.
your hands.
Yes.
How many times we've been telling people in the last 4 years. Rinse toys and pacifiers often.
Yep.
Use wipes and wet
Wet cleaning.
Wet
Yeah.
cleaning.
That's probably the biggest beneficial impact that you can have if
and
you
most
live-
likely the least done.
Yes, correct. I'm guilty of it myself at my house. Oh, sorry, microphone.
Yeah, so if you think about the lead dust that's settling, you don't want to use just a broom because that's just going to,
Poof, and poof
Okay.
somewhere else.
you want to use, we actually provide Swiffers, wet
Okay.
Swiffers. So you want to use a wet cloth, whatever it might be, to wipe those surfaces down.
Windowsills, around door frames, on trim pieces.
And
Those are all
obviously the
good.
last
Yeah.
piece is
Yeah.
getting things painted over.
Correct.
and,
Yep.
Correctly.
Especially if you live in a house pre-1980. We like to use 1980 as our threshold because even though the lead-based paint was banned in 1978, I'm still
What,
using
people still
using paint in my house from 3-4 years ago.
Okay.
So
So how many remediation projects would you say are ongoing at this particular stage where you have what I would say is more than just sealing stuff?
For our elevated kids, Do you?
I would say probably about 45. A lot of the cases we have
that's
are
a lot.
multiple. Yes, yeah, and we track all of those.
And how long does a remediation like that take?
Usually, I don't know, it really depends on the scenario. We are a little bit, we work with homeowners where it's a homeowner occupied dwelling, and we try to provide paint when we can, and education, and our time, and re-inspections and dust wipe sampling to make sure that everything is staying clean as they're doing the work. We try to be as flexible as we can be while thinking of the child that has been exposed. And for rental situations, we give pretty stringent deadlines to complete the work.
So I do want to we have about 3 or 4 minutes left.
Okay.
I wanted to talk about pipes
Sure.
because that is a piece of this. So as I mentioned before, that Kiplinger article, lead pipes are an issue in Cayuga County. You're in the process of doing, and I hope I'm saying this right, a lead service inventory.
Yes.
So
Yeah.
what is that, other
Yeah.
than an interesting name?
So if you're on public water, you have a main that runs usually through the street, and then you have what's called a service line that taps off of that main into your house. And lead was a very popular material to use from the late 1800s to the mid 1950s. And so, as you can imagine, there are a lot of places with a lot of lead service lines. Thankfully, the city of Auburn isn't as affected as, let's say, the city of Syracuse is, but not to say that we have no lead service lines in our communities.
So how are you, what's this inventory
Yeah.
include?
Yeah, so the federal government has said that all public water supplies must inventory their service lines throughout their water systems by October of 2024, and that includes both the public side in the right-of-way and then also the private side that's owned by the homeowner.
So how are you coming to my house and test?
So there have been, I hope that you've heard maybe a little bit of a campaign over the last several years of reporting. There's a bunch of videos that can help you define what is coming into your house, if it's galvanized, if it's copper, if it's lead, and then the water system requests that you provide that information to them, or they will come and knock on your door and request to go take a look.
So when's the deadline for this?
October of 2024 to make a good faith effort.
So if nobody's come to my house yet, does that mean I'm safe, or that means I'm still waiting for somebody to come knock on my door?
Are you on public water?
I am on public
In
water.
the city of Auburn?
I am.
Then you can call the water department and say, I would like my service line inventoried.
Okay.
And they also have been using, there's a chance that they already know what your service line is based on historical records.
And so the flip side of that is that most homeowners in the city of Auburn would tell you that when there's a problem between the street and their house, they have to pay for it. So asking the government for help to look at something is opening them up to some extra costs. So how do you
Sure.
deal with that issue?
Yeah, so thankfully there's going to be money available, and I'm not sure how much and by whom, money available to replace lead service lines. Just recently, last month, EPA came out with another revision to the rule saying that all service lines had to be replaced within, I think, a 10-year time frame.
Well, we've got a lot to cover. We have not covered it all, but I'd love to invite you both back to talk about not only an update, whether you knock on my door or not, to look at that.
They probably already know.
They probably, well, I was going to say in the city of Auburn, they have a fairly decent
Yes.
idea. There were 1970s, 1990s, there were major overhauls of the system. So that's different, but there are other public, where would there be other large public lines in Cayuga County?
The village of Weedsport, probably village of Port Byron, and the village of Moravia are 3 that come to mind.
And are those being looked at as well?
Oh, yes, everyone has to do it. And we
Okay.
also do periodic sampling of water, whole water systems for lead.
Okay. So our guests have been the new Director of Environmental Health, Ani Fish, and congratulations again on your new job, and the Director of Health Education and Public Information, Deborah Pickering. I want to thank you for putting this show together. You put so many together for us. Your office has been great on this, and we'd love to have you back on this and other topics in the coming months. We'll return on Tuesday with a discussion of foster care, again fostered by the county, with Ms. Sacco, and I think Wendy Armstrong will be here representing the county, talk about foster care, and then we'll have Jeff Ludwig of the Seward House here to talk about what's going on at the Seward House next week. On Thursday, Assemblyman John Lamondis will be in the studio to give us a state update, including about the state budget, And then we're rescheduling Karen Belcher of the Food Bank of Central New York to talk about not only what her great agency does, but specifically what they're doing in Cayuga County, which is at the end of a 19-county area. In the coming weeks, we'll have Senator Rachel Maya will be in the studio, as well as several other guests, including new County Administrator Steve Lynch will be joining us, as well as Jeff Dygert from the city, Mary Beth Leeson, the new comptroller there, as well as several other guests. And we will hopefully be bringing you several primary forums with Robert Harding of the Citizen, asking the questions of the candidates. In between, if you would like to suggest some ideas for guests or for shows or have questions you'd like to ask, you can send them to cozguytho@aol.com. But I'm Guy Cosentino for Cayuga Community College. I want to thank you for watching. I hope you have a great weekend, and we will see you back in the studio next week with shows on foster care, the Stewart House, the Food Bank of Central New York, and a state update. And they'll tell us when we're out. So thank you. I know we didn't cover everything, so.